Hi, everyone. Welcome to Sudozi Finance Friday. I'm Rose Pankunas, founder and CEO of Sudozi. Every week, we chat with an amazing strategic finance professional. And this week, we are excited to have Alex Armbruster from Edwards Lifesciences. Well, welcome, Alex.
Thanks, Rose. I'm excited to be here today.
All right, Alex is a special guest because for many reasons, but most particularly, I've just been fascinated understanding his industry because it's just so different from my day-to-day in B2B SaaS and in consumer technology. And so I'll in our 15, 20 minutes here today, we'll go through a little bit of Alex's background, really agile general athlete that is currently leading finance for a couple teams here at Edwards. And then also we'll talk about just the medical devices space, the heart space, and bring it back to finance and finance leadership. So Alex, I'll pass it over to you. Why don't you describe in your own words where you started in your career and your initial degree?
Sure. Thanks, bro. So my undergrad degree is in bacteriology, which there's all of 6 schools in the entire country that have that as a degree. So not your traditional finance path, but in my senior year, I started taking a few business courses just to kind of round out my education and fill in some spots. And that actually sparked a really strong interest in the business world. It was way too late to change degrees at that point, but it set my career path on a very different path than what I was initially thinking when I was going through my undergrad.
Nice. When you think back to that time, what's one thing or two that you got from the actual science part of your degree that you still bring out today or leverage today?
I think it really is the whole thought process, whether it was running experiments or looking at things analytically and
Mm-hmm.
trying to understand what could be causing the results of that particular experiment. It's just that kind of thought process that still resonates today. The details on bacteriology clearly do not anymore, but yeah, it's just that thought process, that approach that I take.
Makes sense. All right. So you're like, okay, I had this degree, but this is an area that I'm really passionate about. You go out into the professional world and you're at GE Capital, Boston Scientific. Share a little bit about those early experiences.
Sure. So my first role post college was selling copiers for 3 years at Icon before I quickly realized that quota hanging over your head every day was really nerve wracking and just not something I was either really good at or something that I wanted to manage. But I loved supporting commercial teams. I loved that idea. So I moved to GE Capital in a commercial support role, and really the rest of my career has been working really closely with commercial teams and helping them be as successful as possible. A couple of years after I joined GE Capital, we had the great financial crisis of 2008, 2009. And it kind of my division at that point, we laid off 80% of our workforce. And unfortunately, I was one of them. But in grand scheme of things always tend to work out for the better. And ultimately, a couple months later, I landed at Boston Scientific, and it blended these two passions I had, because even went back to undergrad, I initially was thinking pre-med, realized that probably wasn't the path. But coming to Boston Scientific, I now had a role that was commercial support, but also working for a company that's doing things in the medical field, that's helping to improve patients' lives. And it was a really nice blend of both of those that enabled me to kind of find a passion that I really enjoyed for my career up until this point now.
Yeah, that's fascinating. So two things I want to just reflect on. One is I don't think enough finance professionals have had a quota in their life. Really go out there, even if it's not in your day-to-day job, go out there and get a quota and try to sell something or try to recruit someone. Really gives you a unique perspective of being actually in that job and the 360 view of running an organization. So kudos to you for actually having had a quota professionally before. The second thing there is, as we work with a number of different companies, we actually hear that part about, hey, I thought I was going to go to med school because that was the only way to really impact patients and impact lives. And then realizing there is this whole ecosystem, whether it's on the business side or on the policy side around that they can actually impact healthcare. And so that's amazing that you had that opportunity, and are able, or clearly have excelled and able to have your leadership on that side of the just healthcare and medical space.
Yeah, it's
All
really
right.
fun being a part of that,
Yeah.
and seeing. I mean, even from when I've trailed along with sales reps and seeing the direct impact of a patient that gets a pacemaker or gets a stent or whatever it might be, how it can make them feel significantly better very
Yep.
quickly. It's just cool to see and hear the different patient stories ultimately.
Yeah, absolutely. My mom's actually an RN and a nurse, and the fact that she's actually able to impact people's lives day to day is a little bit different. I impact people's lives indirectly
I,
through better spend decisions and optimization.
and I'm the same way. My wife is an RN as well, and she definitely plays a much bigger role in impacting people on a day-to-day basis than I ever could imagine too.
Yeah. Yeah, it's all different impacts, direct or indirect. Okay, cool. So you're in the sales operations role, and you actually shifted into a similar role at Edwards. Is that correct?
Yeah, I was at Medtronic and I took a lateral move to take on a blended sales ops finance role for a year. But ultimately, me and my family wanted to get back to Southern California, where we had lived for a couple of years earlier in my career. And I had this opportunity to take on a sales operations leadership role with the critical care business at Edwards and get back to Orange County. And so we jumped on it in 2019 and moved from Medtronic to Edwards at that point.
Nice, nice. Who wouldn't jump on an opportunity, both from a career perspective and the location perspective, to move to Southern California? All right. And so I'm embarrassed to say I actually didn't know too much about Edwards before we started chatting. And I'm going to go on a limb here and say most of our listeners don't actually know too much about it, because if we haven't been a direct patient or, had that interaction. If you don't mind, share a little bit about what the company does, its rich history, and how you got excited to go to Edwards.
Sure thing. So Edwards is really focused in two primary areas: treating patients with structural heart disease and critical care monitoring. The bigger portion of Edwards is especially focused in the transcatheter aortic valve space. They were one of the pioneers in that space when it came to even to the US just 10, 11 years ago. And it's really enabling, instead of patients having to have their chest cracked open and replace a valve that way, they can do it with a catheter through the leg, and the patient is able to go back home a day or two later with a pretty easy, comparatively, recovery period. And it's a really neat area because there's just a ton of underserved patients in this. We continue to find new patients and new opportunities to impact more patients all the time. And Edwards is now focusing in the transcatheter mitral space, which is an underserved area too, putting a lot of R&D dollars into that particular space to help grow that. For me, I'm in the critical care business, and this is a portion of the business that I didn't really know until I came to Edwards, but it's been really fun learning about what we do in this area, because we really help monitor patients during surgeries or post surgeries to try and identify and help keep patients out of low blood pressure events. Because when your blood pressure drops too low, you can injure your kidneys, which could potentially result in dialysis or something down the line, and just ultimately has adverse impacts on the patient, whether that's a longer length of stay in the hospital or other complications that may result of it. So our monitoring technologies help inform clinicians of what's going on with the patient. And then our smart recovery technologies that we're investing heavily in is starting to use algorithms to help predict when a patient's going to have an adverse event, enabling the clinician to intervene early and ultimately prevent it, and not even have the risk of any kind of adverse event from the patient perspective.
Wow, so much to reflect on there. I mean, going back to that bacteriology degree, I'm sure a lot of statistics in research that, different type, but probably so much data science and engineering that's going into the software
Definitely.
of your products today.
Yeah, I mean, Edwards is a leader in how many dollars we invest into the R&D group as we continue to try to innovate our space. We stay really focused from a technology perspective. We try not to go too broad. We believe structural heart and critical care is an area that we can really put an emphasis on and make meaningful, innovative changes by putting that focus on those two specific areas.
Makes a lot of sense. And so, as you were learning about this business and the technology that goes into helping the patients and that whole flywheel, share a little bit about your first 100 days in the critical care business, and just like what were you learning, who were you speaking with, what sort of models were you building to really grasp this value part of the company.
Yeah, the first 100 days were interesting because when I joined, the critical care business had acquired a small company called CasMed about 6 months prior. And we were looking at the start of 2020 to go live with a commercial structural realignment of integrating the CasMed team with our Edwards critical care team fully. And so I joined right as we got alignment on what we were going to do. And so I spent the first 4 months just purely focused on execution, how we're going to do a sales realignment. And that was really the sales operations portion of my job, was territory structure, quote allocation, and how to develop incentive plans to structure the team to help drive the right strategic initiatives for the business. And so it was working with really sales leadership and the marketing leadership to understand the key drivers of our business, and understand where we want to put the emphasis for incentive plans that ultimately drive sales behavior to make that successful with the integration that we were working on.
Yeah, makes sense. And so in terms of that sales ops muscle that you had, really is applying it to this new combined organization and trying to figure out the most optimal way to actually deploy the technology and deploy the impact out into the field.
Yep.
It's super interesting. And any hiccups or any sort of like, hey, I would have done this slightly differently, or stories? And you can also say you did everything perfectly too. I would 100% believe you there too.
No, we didn't do everything perfectly. We probably got too complex in the incentive plan, but the reality is 3 months into 2020, COVID hit and everything got kind of blown up. So it gave us a general opportunity to reset coming out of COVID and to simplify things and just make things a little bit easier.
Yeah. And maybe this is, to the extent you can share, there's so much about remote work these days, right? But a big part of what you all do is physical with the hospitals or with the other institutions that you work with. And so how much of your team or the sales team that you partner with is remote, and you can do your work remotely, or how much are you actually out in the field, traveling, staying in places?
So our sales team really does get into hospitals and partner with clinicians. The technologies are complex enough, or there's enough questions, and or a physician might not be using it every day, that they might have questions. And we've always had to try to have like a higher touch model of partnering with physicians, nurses, anesthesiologists, whomever, to help them understand the way our technologies work. And so it could be education, it could be training, it could be helping support an individual case on any given day. So during COVID, when the team all of a sudden was quote unquote kicked out of most hospitals across the country, it became difficult, and they've adapted to being able to FaceTime, go on Teams calls, whatever, to be able to connect with clinicians. But really they try to connect in person, and help support the patient during a case or post case from a monitoring standpoint.
Absolutely. All right. And so as you're trying to put the model together, do the reporting, do budget variances, what's like a monthly cadence for you with your business partners these days?
So since I now have a blended role of both finance and sales or operations, it all kind of it supports the full US P&L. So it works well. Like month close, we are tying out final sales, and kind of providing the retrospective look of how sales performed. Then we quickly pivot into the monthly forecasts and providing
Mm-hmm.
corporate a go forward look of what we expect for the balance of the quarter, the year, et cetera. And then over that time period too, we're working through calculating the incentive comp for all of our sales team, providing some reporting on just general performance and quota performance periodically throughout the month. And really my team gets involved in a ton of other just data and projects for the broader critical care business. And so there's things going on any given day, week, month that we are pretty deeply involved with that just support the overall business that aren't necessarily forecast or kind of what you'd think is just your
cadence.
core finance cadence.
Yeah, understood. So coming up on the last few minutes here, in terms of the breadth of experience you've had and the different types of roles, what's one thing earlier in your career that you might have spent a little bit more time on knowing everything you know now?
It's a great question. It's something I think about, and as I've supported commercial teams, my very nature is to be a little more conservative and risk adverse. And what I've seen through different roles I've had is making some of those big bets and being a little more aggressive in how you approach something can really pay off in a big, meaningful way. And so early on in my career, whether it's supporting pricing and contracting or supporting just the strategic initiatives, I would try to push myself to be more aggressive in how I think about it and be more willing to take on some of that risk, because I've seen it pay off big time for multiple different companies and roles that I've had over the time.
Makes sense. And yeah, take a little bit more risk and be aware of the risk spectrum.
Yep.
That you're on.
You have to take calculated risks, but I've seen other finance professionals I've worked with be ultra conservative too. And that's kind of, like I said, that's kind of my natural bend. So I think there's ways to be appropriately aggressive in taking risks.
Makes sense. All right, wrapping up here. What's a fun fact about you that you'd like to share with everyone?
So for me, I'm such a numbers nerd. I love spreadsheets. I love anything to do with numbers. So I spend my daughters, all three of them have played softball. And I spend a ton of time keeping the scorebook and tracking stats for the teams. And a lot of people don't like doing that, but for me, that's like one of my favorite things to do. So that's where I nerd out on the weekends is keeping stats for their softball teams.
Nice. I'm sure they appreciate it. Get stats from every different angle and every different type of play. You have that cut there on your sheet. Awesome. Well, this has been amazing, Alex. Really appreciate your time today and just sharing and having us all be able to learn a little bit more about your world and Edwards. Have a great weekend, everyone. Thanks again, Alex.
Thanks, Rose. This has been fun.
All right. Bye.